The risk of ectasia is important that we go beyond topography, because some of these patients with unexplained ectasia after LASIK, they definitely may have some susceptibility that we have to detect before surgery. Ectasia is the most feared complication after LASIK, and we should be alert to identifying with an objective test the ectasia susceptibility. The ectasia susceptibility is a different thing than keratoconus. Keratoconus is the phenotypic expression of the disease. When we have ectasia susceptibility, we may have a normal clear cornea, patient with normal uncorrected and best correct vision. However, we should be able to detect with a sensitive test and also specific test the susceptibility for ectasia. With the Pentacam, we develop tomographic characterization of the thickness profile along with elevation in the Renato Ambrosio display, that we got a very high susceptibility, very high sensitivity for detecting the susceptibility of the disease. When we talk about detection of the disease and detection of sensitivity and evaluation of sensitivity and specificity, we should understand that we have to train a normal and a disease population. The normal population is easy because we get tons of patients that have done LASIK and they are stable. However, it's a challenge to find those cases that had LASIK ectasia and we have the preoperative exam before the surgery that could characterize tomography and also biomechanics. With the Renato Ambrosio 2, we got a very nice increase in sensitivity, but with the third version, we also got a little bit better, and in terms of statistics, we got a better ROC curve in in the detection of keratoconus and the form-fruit cases. One of the concepts that we developed is that form-fruit keratoconus, which is what we consider to be the ectasia susceptibility form, is different than the keratoconus suspicious on topography. Those are two different things, because the KCS, or the keratoconus suspects on topography, they may present in a patient with a normal configuration of normal corneal architecture, normal corneal biomechanics, and the form-fruit keratoconus, they may present in a patient with a green, normal front surface keratometric map. This is important that we go beyond topography and central corneal thickness for evaluating and being more sensitive to detect the form-fruit case, and also more specific to detect that this KCS is a normal architecture cornea that may eventually benefit from custom refractive surgery.